Question 8. Norma basalis, external surface of cranial base. Here you have the external surface of cranium. So I will describe what we can see on the external surface. Firstly, the maxillary bone. We have zygomatic process, alveolar process, palatine process, and infratemporal surface of bone. Next you have the zygomatic bone with zygomatic process, a zygomatic arch. Palatine bone, inferior surface of horizontal plate. Sphenoid bone, the infratemporal surface of greater wings. The pterygoid processes, medial and lateral plate. And the inferior surface of body. You can see the vomer bone, the temporal bone, inferior surface of petrous pouch, the external surface of squamous pouch with zygomatic process, tympanic part, styloid part, and inferior surface or external surface of mastoid part. Lastly, we have occipital bone, inferior surface of basilar part, inferior surface of lateral part, condylar fossa, and external surface of squamous part. The external on the Norma basalis, the external surface extends from foramen magnum to the external nuchal line. Other important structures is the inferior orbital fissure, that would be behind the teeth here. The borders are the greater wings and the maxillary bone. Then you have posterior nasal apertures, also called choanae. The borders are horizontal plate of palatine bone, medial plate of pterygoid process of sphenoid bone, inferior surface of sphenoid bone, sphenoid body, and a vomer bone. Lastly, we have infratemporal fossa. That is here, you see the staple line. The borders is the infratemporal surface of greater wings, the body of maxilla, infratemporal surface, lateral plate of pterygoid process, and ramus of mandible. Lastly, we have the vessels and nerves transmitted through the foramina on the Norma basalis. First we have greater palatine foramen. Transmits greater palatine nerve. Then we have lesser palatine foramina with lesser palatine nerves. Then we have pterygoid canal on the pterygoid process somewhere. Contains nerve and vessels of pterygoid canal. Then we have foramen ovale with mandibular nerve. And we have foramen spinosum with middle meningeal artery. And we have carotid canal with internal carotid artery. Jugular foramen with internal jugular vein, 9th, 10th and 11th cranial foramen with facial nerve, and then mastoid with emissary veins, and also condylar canals with emissary veins.